Good evening, Camille.
Good evening to you, Amy. And yes, they are trying to make room for more pediatric patients. They're also trying to figure out who's going to staff. They need more nurses and they need more respiratory therapists. Take a look. Hospitals across the country, including right here in Metro Detroit, are seeing a surge in cases of RSV.
It can be thought of as almost a common cold virus. The problem is it comes on and can infect a lot of people really fast, which is what it's doing this year.
All three Beaumont hospitals with pediatric units are dealing with a record number of RSV cases among children.
At any given time, we're holding 7 to 19 children in our emergency departments waiting for beds in the hospital.
Doctors stressing they will never turn anyone away, but they're asking parents to be patient as they work to make more room for pediatric patients. Experts say about 20% of people who contract RSV get seriously ill. Young children and elderly adults particularly at risk.
It comes every year. This year it's really early, and it's much more prevalent than it has been in years past.
But why the intense surge in cases? Doctors say that is the proverbial $10 million question that no one has the answer to yet. One theory is that since people were vigilant about social distancing and hygiene during the pandemic, there were less cases. But that doesn't explain why they're at an all-time high.
I will say in my 25 years as an emergency physician, a pediatric emergency physician, this is about as bad or worse than I've ever seen it.
Now, it's important to point out that there is no vaccination for RSV. Of course, there is for flu and COVID, and the doctor we spoke with is urging people to make sure their kids are vaccinated and up to date on all their vaccines. But this could be problematic as we head into flu season, as we head into colder months. Obviously, we want to be vigilant with the washing of the hands, the hygiene, and just watch your kids if they come down with this. Make sure that the symptoms do not become too severe. You want to look for dehydration, any trouble breathing, difficulty breathing. You want to get your kid into the hospital or the doctor. For now, we're live in Royal Oak. Camille Neary, Fox 2 News.
Well, certainly scary, Camille, for parents of young children. And we've heard so much about this sort of triple threat, the RSV, the COVID, the flu, all these things kind of coming at one time. But you did mention that this can infect seniors as well. So they need to be really vigilant, too.
Yeah. Obviously, and people who are immunocompromised. I mean, this is something that for the most part, it's not going to adversely affect people. But that's, of course, what we saw with COVID. I mean, we saw at the early days that 80% of the people were going to survive. But then there was that 20% that were going to be very, very sick. What is this going to look like in the months to come as far as RSV goes? We're just going to have to wait and see. But it's definitely, hand cleaning, hygiene. We can't stress that enough.
Absolutely.
Amy, back to you.
All right. Thanks so much, Camille. We appreciate you.